Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today for a very special podcast because I am with my amazing and gracious co-host, Dr. Millicent Ravello. How are you, Dr. Ravello?
I'm super gracious.
You are.
How are you?
I'm pretty gracious also, and happy to be here because we have a guest.
We do have a guest. We are very excited.
We don't want her to sit here awkwardly.
I know. So we're going to introduce her first because otherwise that'd be weird.
Do you want to introduce her?
So this is Dr. Hillary Jenny. Dr. Jenny is visiting us from
Johns Hopkins.
Johns Hopkins, and originally from Wisconsin. And so Dr. Jenny is visiting us here at the Roxbury Clinic and Surgery Center because she is a potential fellow coming to check out the scene and see if she might want to join us for her fellowship in a year or two.
Yeah, and we're not going to grill every fellow.
No, this is not the usual standard operating procedure.
She walked into this.
I know. We're like, hey, what are you doing? You're not leaving till tomorrow,
pressure.
Right?
No pressure. Just got to nail it on the podcast. Otherwise, the fellowship is out the window. Forget it.
But the reason we have the lovely Dr. Jenny on is because we were going to talk today about how one becomes a plastic surgeon and what the steps are to get there and exactly like who we are. Like, how did we get here? What are our credentials? Like, are we even doctors? So that's what the impetus of this was. And it just so happened that Dr. Jenny was here. So it all worked out pretty well.
So welcome, Dr. Jenny. How
Welcome.
Are you?
Thank you. I'm doing great.
Good.
Yeah.
Are you also feeling gracious because I have a gracious co-host?
Doubly gracious. Yeah.
That's good. Well, we go through a lot to become plastic surgeons.
Mm-hmm. We do. There's a lot of hoop jumping.
There's a lot of steps.
There's a lot of steps to get here, which, and I say this all the time, it cracked me up. But when I was going through all of these hoops, which we will get to, I remember my mom very distinctly being like, I didn't even realize plastic surgeons were doctors. As I'm like taking my like 5th board exam and getting like very little sleep and like trying to get this position and I didn't even realize plastic surgeons were doctors. So I'm guessing she's probably not alone in that sentiment. So
that's true.
Let's talk about sort of how we get here and what are those hoops?
Well, first of all, I think let's establish where Dr. Jenny is in the process. So,
but we haven't even gone through the process yet.
But that's why I want to come up to it.
Okay, fine.
You want to go through the process?
I want to go through the process. Otherwise, it doesn't make any sense.
Fine. Process. So, first things first, you were born.
I was born.
What was that like?
Yeah. From what I can remember, it was a little wet and a little loud.
It was loud. And then you grew up, went to high school, went to undergraduate college, which took you 7 years, 8 years? How long was undergrad?
Oh, you're assuming I graduated. But
See? There you go.
Yeah.
So usually 4 years. Did you do it in 4?
I did in 4.
There are options to do med school and undergrad combined, which you would actually do your undergrad and medical school usually in 6 years. I know BU has some program like that.
Yep.
But you did a traditional undergrad and you majored in?
I double majored in neuroscience and music.
And this was where?
MIT.
She's a smarty pants.
Yeah, whatever.
Okay,
fine. So,
next.
fine, you're smart. Got it. That's brilliant.
So 4 years at MIT, double major in music and neuroscience.
Yep.
Okay. And then...
Which was easy, I'm sure.
I'm sure.
It's a piece of cake.
And so then what happened after undergrad?
After undergrad, I went to med school. So I went to the Icahn School of Medicine at Mount Sinai. I did 4 years of medical school there, but I also got an MPH. So I got that concurrently during my first 2 years. And then I decided to take a research year once I decided I wanted to go into plastic surgery.
So the MPH, that's interesting. Did you do that? Was that like an offering of Sinai, or did you just say, I think I'm going to do this while I'm doing this?
Yeah, they had an MPH program. And so it was October, I think, of my first year of med school. And I just kind of wanted to do something in addition or something else. And so I
because med school was too easy.
Yeah, piece of cake.
Clearly.
I was interested in public health, so I don't know.
Yeah,
I missed it. So, I asked if I could join a little bit late. And they said, well, midterms are in a week and a half, but like if you're willing to take them in a week and a half, you can join. And I said, sure, okay. So I joined 2 classes. And then, I really liked it and I stuck through it.
So MPH is a master's in public health, just to clarify, which is great. That's awesome.
And so then you applied to medical school. I mean, after after medical school, you applied for your residency.
Yes.
Which is where we're up to now. So, undergrad, MIT, med school, Sinai in New York. Then you apply for your residency, and we have to go through the match, which is a process of how you get your residency. where you're going to basically send out applications to places that you want to train.
And you really have to be okay with going to any of these places.
Yeah.
You have to be
That's for
okay
sure.
with every single one on that list. You have to be okay with going to those places, because once you've interviewed and you've gone to all the places, you create a match list, which you put in the order of your favorites, 1, 2, 3, 4, 5, 6, whatever. The residency programs that interviewed you also do a rank list, 1, 2, 3, 4, 5, 6, 7 of all the candidates they interviewed. And then you get thrown into this computer, and the computer starts matching people up with their first choices. And then it spits out the name of where you're going. And on match day, it's this big flurry. It's one day, same day across the entire nation. And every single fourth year, is it fourth year?
Fourth year.
Fourth year. Every single fourth year medical student gets an envelope, and you all open the envelope at the same time, and it tells you where you're going to be for the next 6 to 8 years of your life. And you don't have a choice. That's where you're going. You can't be like, so I wasn't entirely sure I wanted to come here. Can I take that back? Can we trade these? You can't do that. That's where you're going. Have a good trip.
Binding contract.
Yeah,
Binding
it's a
contract.
binding contract. If
Yeah.
you put that school or that place on your rank list, that is a binding contract that you will go to that place.
Now, I mean, you're at a good place, but let's be serious. You really didn't want to go to Johns Hopkins, did you? That wasn't number one.
I lucked out.
Of course it was.
I'm sure it was. It's a great place to
That
train.
is an
Yeah,
amazing
it's
place to
amazing.
train. And so that's residency. So I think it's interesting to go back to something you said shortly before, that you did a research year while you were in medical school, and you said because you wanted to go into plastic surgery. So let's unpack that just a little bit,
Yes.
because
Yeah.
I'm sure where you are now is even more competitive than where I was when I was going through residency matches. And historically, for the past at least 15 years, plastic surgery is one of the most competitive
Yeah,
residencies to get
definitely.
into. It's like dermatology, plastic surgery, ophthalmology, maybe
Ortho's up there,
So those
yeah.
are sort of like the top
Anesthesia's
ones.
up there, believe it or not.
Really? Huh.
Yeah,
Let's climbing on up.
it is.
Yeah.
Yeah, it's up there.
But
Neurosurgery's
those are
tough.
sort of the top ones, which you really have to be top of your class, published papers. That's where you really have to be top level. And you said you did an extra year of research.
Yep.
Because you wanted to be competitive.
Yeah. I didn't initially know I wanted to go into plastic surgery. I thought I was going to do OBGYN. And then I realized in my third year, actually, I started with surgery because I was like, I definitely don't want to be a surgeon. That sounds terrible. And then I got there and I was like, oh, shoot, I like this a lot.
Yep.
And I had a lot of plastic surgery residents on my teams, and they sort of took me under their wing, taught me how to suture. And I really just felt like I had found my people. And I was like, wow, I really get along with these people. I love being in the OR. I think I actually need to go into surgery, and even more specifically, plastic surgery.
And so hence the extra year of
Hence the year, yeah.
research. Then you matched and got your spot in residency. And residencies for plastic surgery can take basically one of two forms at this point. You can either have what's called an integrated program. And so that's what you are in right now. That means that it is a specific program for plastic surgery that you go into right out of med school. And usually it's anywhere from 6 to 8 years, depending whether or not they throw a research year or two in there. And that's when you start out doing some general surgery, but from the start, from the get-go, you're being put into plastic surgery rotations so that you have a full 6 years of exposure to plastic surgery. The other route, the route that I took, is a 5+2 or 5+3 route where you do 5 years of general surgery. You can also do 5 years of ENT. That's another somewhat common thing to do. And you go through that entire residency. You become board certified in that residency. You are a general surgeon or you are an ENT. And then you choose to go on and do an additional 3 years of training in plastic surgery. And so that's an additional way of becoming a plastic surgeon.
Yeah, and you can also get in. So to become a plastic surgery resident, you can get there through orthopedic surgery, urology,
OMFS.
yeah, OMFS, ENT, and general surgery.
Yeah,
I think those are
basically
sort of
any surgery residency.
Yeah.
Yeah, you probably could get in from any surgery residency, but the applicability of it is kind of low for some surgeries, so they probably wouldn't take you per se. But yeah, as long as you've completed a surgery residency of some kind, you are eligible to apply for that extra 3 years of plastic surgery training.
And Hopkins is an integrated.
We are integrated. We also have an independent route as well. So we take one independent resident a year.
I think that's the same at USC, right? There's one independent spot.
1 to 2, depending. Sometimes residents in the integrated program will go out for research for a couple years. So if there are extra spots that the residency program needs to fill to meet their quota of residents for any given year, they might bring in an extra independent. An independent is a resident that's done a full general surgery residency already. So they come in as what's called independents. And then they do the last 3 years with the integrated residents.
Yeah, and so at this point, the reason that you're here is that you are looking to do the fellowship.
But wait, there's more training.
It's not over. That's not enough years yet. And Dr. Hillary is
more.
actually 47 years old. I mean, she looks great, but we're plastic surgeons.
So, I mean.
But the next thing is to do a fellowship training, which isn't necessary. You don't have to do that. You could just go out into practice.
Yep.
Yes, you definitely can. You can go out and just practice as a plastic surgeon doing whatever scope of plastic surgery you feel comfortable. You can do the entire breadth of plastic surgery. But particularly if you want to super focus or specialize in one given area, or if you're planning on practicing in an urban area, a lot of times it's really important to get a little bit of extra training in one particular area. And plastic surgery covers a huge breadth of additional specialties within the umbrella of plastic surgery, which a lot of people don't realize. Like, a lot of people don't even realize that we do hand surgery, which I am happy to not do hand surgery ever again.
No, thank you.
But there are those that really love doing hand surgery and do hand fellowships. There's microvascular fellowships, which you do a lot of these complex reconstructions for breasts and other parts of the body. There is, what else is there? Craniofacial. So patients with cleft palates, cleft lips, craniofacial syndromes. That's another really competitive fellowship.
Head.
As
with a
well,
cloverleaf head.
Yes.
It's very, very rare.
Yes, with
thing I've never
bony
seen.
deformities.
Pfeiffer's syndrome.
Pfeiffer's syndrome was all coming
Large
back.
thumbs.
Cruisons.
I'm going to go through them all.
Yeah.
Since you said that word, I'm like, I'm ready to take my boards. That's right. Yeah.
And then for the reason Dr. Jenny is here, an aesthetic fellowship. So that's an additional year of doing specifically aesthetic surgery to get an extra edge on
Which
that
we do
side.
a lot of here.
We do a fair amount.
Yeah.
I understand from your show that you're going to be offering a oral reconstruction fellowship as well.
Yes, I'm going to be specializing in oral lip repairs. Come to me. I'm your girl.
Commissure-plasties.
Love it.
Whatever
The whole
it is.
deal.
Yeah.
If
Born
your
without
mouth
a-
is in trouble.
Born without a mouth, I'm your girl.
Everyone needs a niche.
It's mine.
Evidently. Hopefully you'll get something else, but
Yes. We'll
maybe a nose or something cool.
Something.
But so you're here interviewing for the fellowship. You've been here. You did a week with us, which is, by the way, for other people interviewing for the fellowship, you don't have to visit. It's totally unnecessary. We can figure it out from our interviews and from your letters and all that. But a lot of people have decided to come and visit because I guess it's over. COVID's over from a travel standpoint. You can come, you can stay. And it is helpful because then you get to know like whether you're comfortable here.
Right, what you're getting into. And Dr. Jenny may leave tomorrow or Sunday and be like, nope.
I think
Not putting that on the rank list.
After this week with what she's been through, I think there's a good chance that there's no way she's coming back here. But that's okay. But that I think it is good. I mean, you know, what made you think like, and did you have to take elective time to do this, right? Or is it vacation time?
It's elective. Yeah. So I get 1 month of elective this year. And so I knew that I wanted to just spend time getting to know some of the programs that I was highly considering, and it seemed like a good use of time.
Yeah. And you know, it does make a big difference because you want to you don't need to do this year. You know, the year of the fellowship is totally elective. So you want to make sure you line up at a place that you're really comfortable. It is really important. It's got to be a match. That's why we have the match. I think it's smart. I wish we had. I didn't have a fellowship like this that was really available. There was this the fellowship in Manhattan. Ioneer was available, but it's essentially went to NYU residents, and that was kind of the deal. So like, I didn't even like shoot for anything like that. My fellowship was basically on the job training as a tenure track professor at UC Irvine. You know, with you know some pretty smart people there, so it was good. But I think this fellowship is a big deal, especially you know since we were residents. You know, not that you were in my vintage, but like in my time, we didn't have work hour restrictions. But with work hour restrictions, you can't get as much surgery in. You know, you really don't. You know, I averaged like 117 hours a week for 7 years straight. You guys aren't allowed to do that. The residency program will be in trouble
Right.
if you do that. So
Yeah.
the training's different today, and
Yeah.
so I think fellowships are really important. I think I'm sure you operate plenty in your residency.
Quite a bit. Yep.
Yeah. So
Quite a bit.
and that's how USC was.
Yeah.
Yeah, you
That's
operate
how
a lot.
Pittsburgh
But
is.
aesthetics is hard to get a lot of experience in at any residency. There are very
is.
few residencies that have really strong, robust aesthetic experiences for residents. So it's not uncommon to come out and want to do a little bit more just to get a better foothold and training in the aesthetic sphere, which is great.
Yeah. I mean, what were your reasons for wanting to do the fellowship?
Yeah, I mean, I think I definitely get really good operative experience at Johns Hopkins, but less aesthetic than reconstructive. You know, we're a tertiary medical care center. We get a lot of really complex reconstruction. We get a lot of craniofacial trauma at shock trauma. So I feel like there are certain things that I knew I would leave residency feeling pretty comfortable doing. But, you know, I really wanted to do aesthetic surgery, and I wanted to do aesthetic surgery extremely well. And so in order to do that, I think you have to learn from people who do aesthetic surgery extremely well and spend dedicated time.
Right, and this fellowship's really the only one that does that. So I think, you know.
No bias,
I'm
though.
just kidding.
No bias.
No, there are amazing fellowships out there with really incredible people. I mean, and this year there are more fellowships than applicants. So
Yeah,
typically
really?
there are 30 to 35 applicants for fellowships, and I think there are 32 fellowships now.
Huh.
So when Grant Stevens and I put the Roxbury Clinic together, you know, he'd had the Marina Fellowship for years, I think for 16, 20 years, something like that. And 2014, we had our first fellows for the combined Marina Rocks, and now we've added Dr. Ash Gavami, so now it's Marina Rocks Gavami Fellowship, I guess. You know,
We need a better name.
yeah, I think it should be like the Los Angeles Aesthetics
Yeah.
Fellowship or something. I think we have to
Yeah.
rebrand it
Right.
and rename it, because you know now it's just getting like
It's getting
you can't name
ridiculous.
every office where you go to, but adding Ash Gavami has been a big deal. So it's Marina, Roxbury, and then Dr. Gavami's location, and I think the training is great. But you know there are great fellowships in Dallas, in New York, in Houston, and North Carolina, and there's a lot of places. So you have to go kind of check out where you want to be and where
Yeah.
you're going to get what you want.
Exactly. I mean, there's opportunity cost for doing fellowship. You're not going out into practice, and
That's
so
right.
you got to make sure that it's going to be worth your time.
Yeah, and Brad Calabrese has a great fellowship in Lexington,
Yeah,
Kentucky. I mean,
yeah.
amazing. Like, yeah, I should go do that fellowship.
I know.
think I'd really have fun with that.
You're like listing all these places. I'm like, gosh, I want to go there. I want to go there. That sounds
How
really
fun would it be
fun.
to train with Calabrese?
It'd be so fun.
That'd
I
be
want to
so
go.
cool.
I want to do a fellowship.
You don't get paid very much.
You don't get paid. That's the downside,
And
right?
you
At this point,
have
you're
to help
you
out
don't
as
get
much.
paid much during residency or your fellowship, and your interest on your student loans just accrues. So at some point, you have to stop training and go into practice and actually make money to pay off all that student debt. So you can't be a fellow forever.
And one of the questions that the fellows always have is how much operative experience are you going to have? And it's it's interesting because Dr. Gavami is also new to the fellowship, and he kind of said, well, how do you get the fellows involved? I said, well, I do all my own cases. I have to. Mm-hmm. My patients have paid me to get the result that I am capable of generating. But I have assistants, and with assistants, the assistant is heavily involved in holding retractors and making sure things are tensioned correctly. So there's a lot of learning that happens through the interaction of assisting, the chief, the boss in their surgery. Mm-hmm. Dr. Ravello needs things to turn out the way that she needs them to turn out. Dr. Gavami needs them to turn out the way that he needs them to turn out. So you help do those cases, and in the assistance and in the learning, you get all that. You get all that you need to, because you're already able to operate. So now you're operating, but you're not driving the case. Mm-hmm. However, we have the fellows clinic, and what happens a lot is people call up and say, "Boy, I'd love a revision rhinoplasty with Dr. Calvert," and my coordinator will say, "Great, this is it. Oh, and what's the average cost?" Well, it's X with a lot of zeros after. Yeah. And they go, "Oh my God, my budget's only X with less zeros after." And we said, well, we have a fellows clinic where you can mm-hmm. see a fully trained, board-eligible plastic surgeon who will do the care for you. Dr. Calvert will be intimately involved in this operation, but the pre-op and the post-op will be done by the fellow. And in surgery, Dr. Calvert will be there, scrubbed, and make sure that you have a great result. Mm-hmm. And a lot of people have gotten some amazing results.
Really good surgeries.
Really good operations.
For very little money.
For a lot less, exponentially less. And it's doable. And so the fellows do get their own cases that way very frequently. Plus, you can also come in and see the fellows. And the fellows who hustle get out there and kick doors and shake bushes and shake trees.
Find the patient.
And they get patients in. That's right. I think Dr. Perez flew a patient out from Dallas.
Oh, wow.
Yeah.
That's right. He did.
He did. And by the way, nailed it.
Yeah.
Amazing nose. Did a rib
that was a
graft,
hard
the
one.
whole thing.
Yeah.
In fact, I think that case won us the resident competition.
Oh, that's right.
I think we won the plastic bowl for that.
Yes, so now the stakes are really high, just saying, for this fellowship, because we now have to defend
valued prize.
our fellowship going
right.
forward, because we won the Plastic Bowl Challenge
That's right.
in 2021 at the Aesthetic Society meeting. So now we need a partner for this one. We need
That's
a
right.
2022 bowl.
Yeah, that's very important. I think that's
Just
coming up.
putting that out there,
I know.
fellows.
Yeah, because that's. What happened that we did? I don't think we did that competition last year. Because that was at ASAP's.
Oh, yeah.
Yeah, I think that blew past us.
Oh, yeah. I wasn't there. That was this year. That was, oh my gosh, because this is 2022.
You were not there.
Yeah,
it was in San Diego.
I was
I don't
on
remember a
spring break.
plastic bowl.
Yeah, I don't remember that either.
We did have the Battle of the Bands, which I also have since we're going through my ASAP's trophies now. So we did have the Battle of the Bands, and we did win that.
That's right. That was the focus.
And by the way, you missed this. You would have liked this.
Yeah, it was pretty great.
I think you were there.
I was
right?
there. Yeah, it was pretty great.
Yeah,
But you can't put a meeting during spring break.
I know.
That was dumb.
Yeah, I know. It was. It was during spring break.
Like, some of us have places to go.
Well, that's like the California Society's always on Memorial Day weekend.
I know. No.
Yeah.
I'm not going to be there. I have a
That's just not-
family.
Yeah.
I have children and people that I
Want to do
need
stuff.
to see
Yeah.
a lot more than my colleagues talking about plastic surgery.
Yeah.
Right.
Well, so do you have any questions for us about the fellowship? You've been here for the week. I think you've had them all answered, but we'd be happy to help you with anything else that you need to know.
Yeah, I mean, I think I got it down. I guess the one thing I would say for other people applying is, it's a formal match system. It didn't used to be. And
Right.
if you want to do it and you don't think that you can because you don't know people yet, don't let that stop you. Get out there, look at places, get involved in the community, and you can do it.
Yeah.
I think.
Yeah. You just got to put yourself out there.
Yeah.
You do. It's, and just for our listeners who probably don't know this, there's a massive taboo about going into aesthetic surgery right out of your residency.
Oh, yeah. It's this thing, right? Because most
It's like
plastic
going
surgery
to the dark side.
residencies are, when you do a residency, you're usually in an academic institution. So this is going to be university settings, and they're very stuffy, and they think they're very professional, and they're professors at these university settings. And there's people tend to look down on the residents that want to go into aesthetic surgery as perhaps being frivolous or not, being as important because you're not doing the hardcore reconstructions. Although I think many people would argue that what we do is plenty hard, very hard, and if not even more technically, skilled than some of the other procedures that are out there. But it is for a long time. If you're going into aesthetic surgery as a resident, you kind of keep it hush-hush for the first couple of years. And then as the match starts getting closer, you're like, well, I've been thinking about doing aesthetics, maybe microvascular too. I'm still deciding. And like in the back of your mind, you're like, I've been thinking about this since I came into the program. But you got to play the game. But here's the other thing I also learned, because people said that about going into plastics out of general surgery.
Yes.
When I was going through general surgery, they were like, don't tell anybody you want to do plastics because then they won't take you seriously. And I just found that to not be true at all. Like, if you show up, put your head down, do a really good job, take care of your patients, show up, do the work, they're going to appreciate that no matter what specialty you choose to go to. It's the people that come in, slack off, say, ugh, I'm never going to do this procedure in my life. I don't need to worry about this. Those are the ones that people don't like.
Yeah.
Just show up and do a good job anywhere you go, just in general.
Good life advice.
Good life advice.
Yeah.
Show up, do your hardest.
I don't know that I do aesthetic surgery. I really don't feel like, I do a lot of aesthetic surgery, but I remember Edwin Kwan from UCSF came down to do his aesthetic surgery fellowship. He was the first formal fellow, even though I mentioned I've trained other people in sort of fellowship setting before that. And for the first 2 weeks, we did 10 rib grafts, followed by the next week where we did, I think 4 or 5 600cc breast implants, but for the first 2 weeks.
But in the beginning,
All those graphs.
And only 600 cc's. He said, why do you even have why do you need this consignment? You just need one size of implants. I don't usually put 600s in. I just put in 295s for everybody. Who's gonna be like, oh, he only puts in 600 cc implants. That's not true. So Ed looks at me after the first 2 weeks. I go, so what do you think? He goes, I want to know when my aesthetic surgery fellowship started. He was worn out. I mean, all we did was revision rhinoplasty, and it was like an overload of them. I don't do that anymore. Now I do I think I'll do 2 to 4 a week if I really am doing those big reconstructive rhinoplasties. They're hard and they take a lot out of you, and they're, primaries I can do them in, rapid fire and get them done great, and the patients are happy. But revision rhinoplasty is a very, very tough specialty, and I don't know that that's really aesthetic surgery. I guess it is. I think it's pretty hard stuff. I mean,
it's both. I mean, it's reconstruction and aesthetic, because in the end, it needs to be nice.
Yeah, I mean, you do these, very difficult, body lift cases, and they're just as hard as doing you're in there for 7 hours, taking yards of skin off of humans.
Yeah, percentages of weight. Yeah.
You're sewing up surgical incisions that are taller than you. Yeah. I mean, seriously, right? It's not a joke. I mean, you do a brachioplasty and a circumferential body lift. I mean, you're there for quite some time. It's hard work, and you got to do it right. So that's what the training is for.
And that's what it's for. And then the only thing I will say to sort of cap this off, I will reference you back probably a couple of years ago, a podcast we did about board certification in plastic surgery, because that is the next step. After you've gone through decades of training, then you still have 1 or 2 more hoops to go through, and that's going to be getting your board certification, and that is a whole hoop jumping process.
Yeah.
I keep saying this word hoop jumping because when I was in medical school or applying to medical school, I had
I was.
Yeah. No, I had a friend who'd been with me through this whole process, and she was lovely. And she was watching me, and she's like, I'm exhausted. She's like, you were literally a professional hoop jumper, because she saw me go through the MCATs to get into medical school, to do the USMLE step 1s, to the USMLE step 2s, to do the match. And she's like, all you do is jump through one hoop after another. I'm like, yeah, that's kind of how we do it. So that's why I say hoop jumping. The final one, of course, being that board certification, topic for another podcast. But all being said, yes, Mom, we are real doctors.
Well, that was good. That's a good little roundtable discussion there. Thanks for joining us on this one.
Yeah, of course. Thanks for having me.
Of course,
Dr.
thank
Jenny,
you.
Out here from Johns Hopkins, off to your next interview week, visiting week somewhere. So that'll be great. Hope you'll come visit us again.
Yeah, would love to.
This is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.